Breast cancer. Breast cancer is when breast cells mutate and become cancerous cells that multiply and form tumors. Healthcare providers may treat breast cancer with surgery to remove tumors or treatment to kill cancerous cells. Breast cancer tumors develop when breast cells mutate and grow. What is breast cancer? Breast cancer is one of the most common cancers that affects women and people assigned female at birth, AFAB. It happens when cancerous cells in your breasts multiply and become tumors. About 80% of breast cancer cases are invasive, meaning a tumor may spread from your breast to other areas of your body. Breast cancer typically affects women age 50 and older, but it can also affect women and people AFAB who are younger than 50. Breast cancer types. Healthcare providers determine cancer types and subtypes so they can tailor treatment to be as effective as possible with the fewest possible side effects. Common types of breast cancer include invasive, infiltrating, ductal carcinoma, IDC. This cancer starts in your milk ducts and spreads to nearby breast tissue. Lobular breast cancer. This breast cancer starts in the milk-producing glands, lobules, in your breast and often spreads to nearby breast tissue. Ductal carcinoma in situ, DCIS, like IDC, this breast cancer starts in your milk ducts. The difference is DCI doesn't spread beyond your milk ducts. Less common breast cancer types include triple-negative breast cancer, TNBC. This invasive cancer is aggressive and spreads more quickly than other breast cancers. Inflammatory breast cancer, IBC. This rare, fast-growing cancer looks like a rash on your breast. Paget's disease of the breast. This rare cancer affects the skin of your nipple and may look like a rash. Less than 4% of all breast cancers are Paget's disease of the breast. Breast cancer subtypes. Healthcare providers classify breast cancer subtypes by receptor cell status. Receptors are protein molecules in or on cell surfaces. They can attract or attach to certain substances in your blood, including hormones like estrogen and progesterone. Estrogen and progesterone help cancerous cells to grow. Finding out if cancerous cells have estrogen or progesterone receptors helps healthcare providers plan breast cancer treatment. Symptoms and causes. Common signs of breast cancer and what to look for. What are breast cancer symptoms? The condition can affect your breasts in different ways. Some breast cancer symptoms are very distinctive. Others may simply seem like areas of your breast that look very different from any other area. Breast cancer may not cause noticeable symptoms either. But when it does, symptoms may include a change in the size, shape or contour of your breast. A mass or lump, which may feel as small as a pea. A lump or thickening in or near your breast or in your underarm that persists through your menstrual cycle. A change in the look or feel of your skin on your breast or nipple. Your skin may look dimpled, puckered, scaly or inflamed. It may look red, purple or darker than other parts of your breast. A marble-like hardened area under your skin. A blood-stained or clear fluid discharge from your nipple. What causes breast cancer? Experts know breast cancer happens when breast cells mutate and become cancerous cells that divide and multiply to create tumors. They aren't sure what triggers that change. However, research shows there are several risk factors that may increase your chances of developing breast cancer. These include age, being 55 or older. What are the complications of breast cancer? The most significant complication is metastatic breast cancer that spreads to other areas of your body, including your brain, bones, liver, and lungs. How is breast cancer diagnosed? Healthcare providers may do physical examinations or order mammograms to check for signs of breast cancer. But they do the following tests to diagnose the disease. Breast ultrasound. Breast magnetic resonance imaging, MRI, scan. Breast biopsy. Immunohistochemistry test to check for hormone receptors. Genetic tests to identify mutations that cause breast cancer. Stages of breast cancer. Healthcare providers use cancer staging systems to plan treatment. Staging cancer also helps providers set a prognosis, or what you can expect after treatment. Breast cancer staging depends on factors like breast cancer type, tumor size and location, and whether cancer has spread to other areas of your body. Breast cancer stages are: Stage 0, the disease is non-invasive, meaning it hasn't spread from your breast ducts to other parts of your breast. Stage I, there are cancerous cells in nearby breast tissue. Stage 2, the cancerous cells have formed a tumor or tumors. The tumor is either smaller than 2 cm across and has spread to underarm lymph nodes, or larger than 5 cm across but hasn't spread to underarm lymph nodes. Tumors at this stage can measure anywhere between 2 and 5 cm across, and may or may not affect the nearby lymph nodes. Stage 3, there's breast cancer in nearby tissue and lymph nodes. Stage 3 is usually referred to as locally advanced breast cancer. Stage 4, cancer has spread from your breast to areas like your bones, liver, lungs or brain. How is breast cancer treated? Surgery is the primary breast cancer treatment, but healthcare providers may use other treatments. If you're receiving treatment, ask your healthcare provider how treatment may affect you, including how it may affect your daily life. Complications of breast cancer surgery. All surgeries have potential complications, and breast cancer surgery is no exception. As you're considering your options, it's important to remember that surgery removes potentially life-threatening cancer. In general, the risks of breast cancer outweigh the complications. If you're having breast cancer surgery, ask your healthcare provider to explain potential complications, which may include infection at the surgical site. Can breast cancer be prevented? You may not be able to prevent breast cancer. Just as important, regular self-exams and mammograms can help detect breast cancer early on, when it's easier to treat. Eat a healthy diet. Some studies show a diet that includes vegetables, fruit, calcium-rich dairy foods and lean protein may reduce your risk of breast cancer. Avoiding red meat and processed meat may also reduce your risk. Get moving. Studies show that regular physical activity lowers breast cancer risk. Get screened. Mammograms often detect tumors when they're too small to be felt. Do regular self-exams. Examining your breasts regularly helps to maintain breast health and may allow you to find breast cancer tumors. Some women and people of FAB have an increased risk for breast cancer because family members have it or they inherited a genetic mutation. Genetic screening for breast cancer genes. Frequent breast cancer screenings and physical examinations. If you have an increased risk for breast cancer, ask your provider if you should have additional tests to detect breast cancer, particularly if you're under age 40 and have increased risk. Right now, more people are being diagnosed with early-stage breast cancer, meaning they're diagnosed when it's easier to treat, and fewer people are dying of breast cancer. Data shows 99% of people with early-stage breast cancer were alive 5 years after diagnosis. In some cases, they may be considered cured of breast cancer. But breast cancer can come back, and when it does, it may come back as metastatic breast cancer. Living with breast cancer may not be easy. You may have days when you feel overwhelmed by your situation. Consider the following suggestions for taking care of yourself as you go through breast cancer diagnosis and treatment. Get enough rest. Breast cancer and treatment can be exhausting. Try to remember to rest when you need to, not just when you think you have time. Eat well. Treatment may affect your appetite. Contact your provider if your symptoms seem to be getting worse or if you have new symptoms, like pain or weakness in a different part of your body. You can have breast cancer for years before noticing changes in your breasts like a lump. That said, not all lumps or bumps are cancer. Check with a healthcare provider if you have an unusual bump or mass that doesn't go away after a few days. If you have breast cancer, ask your healthcare provider for information about what you can expect.